video, we're just going to talk about some general disability etiquette that is helpful to know when working with people with disabilities. So, for starters, to define disability, it can be defined as a physical or mental condition that limits a person's movements, senses, or activities. It may or may not be visible when looking at the person. A disability can have an onset that is at birth or later in life. Types of disabilities include cognitive, developmental, intellectual, physical, sensory, but it is most often a combination of those. Some more specific examples you might see include intellectual disability, learning disability, um, someone being deaf or hard of hearing, someone sustaining a brain injury at birth or later in life, a physical disability from birth or sustained later, such as an amputation, paralysis, or burn, spina bifida, Down syndrome, autism, cerebral palsy, dwarfism, and more. And again, each of these likely has a combination of those mentioned categories. So there are two models in which society views disability and those that have disabilities. The main two models are the medical and social model. The medical model is used in a lot of hospital settings, and it views that people are disabled by their impairments or differences, so that disability is a defect within the individual and must be cured, fixed, or eliminated for the person to have a high quality of life. The social model views disability as caused by the way society is organized. So the solution through the social model is adapting the social and physical environment to accommodate people with different abilities to improve their quality of life and opportunities for everybody. While it is helpful to understand the medical model to have a basic understanding of different disabilities, in practice, the social model is usually a better way to approach disability, in which you're focusing on how the environment or activity can be changed to support those with all abilities when they're participating in it. So this provides a bit more of a visual of the different models of disability. In the medical model, all the arrows point in because it views the problem as the disabled person. So it is seeing all of their difficulties as based on the fact that they have a disability. So not being able to get into a shop is because they can't get up the steps, and that the only solution is to fix them basically. And then through the social model, it views the problem as a disabling world in which, in that same example, a ramp isn't available for them to access that place, or that there's not accessible parking or transport for them to get to different locations. And here's another visual, kind of what I just said about the accessibility of a building, in which the medical model would view the issue as this lady's impairment and the solution to be prosthetics or being cured, whereas the social model views that the stairs are the problem and that a ramp should be built for this location to be accessible to those who use wheelchairs. So when speaking about disability, it is important to understand what person first language is. And while it is not always the most applicable one to use in a situation, it's important to understand what it is, and it's usually the safer bet when you're first meeting someone. It is used to emphasize that people with disabilities are people first and not defined by their disability. It can convey respect, and should be used both verbally and in writing. But it is important to understand there is person first language and identity first language, which we'll talk more about in a minute. But the way someone self-identifies may be different from person first language, especially in the autism and deaf communities, in which people may prefer identity first language, but it is the safer bet to start with person first and then pick up on what kind of language that person is using and what they would prefer to be called, and then always go with what they prefer, how they prefer to be referred to. But it is generally more respectful to use person first language. So leading into person first language, we have this little cartoon, just kind of humanizing people with disabilities, because this can happen sometimes where this lady says, so what do you prefer to be called? Handicapped, disabled, or physically challenged? And this man says Joe would be just fine. So it's just really emphasizing viewing people as people and not being intimidated by somebody's disability. So these are some examples of person first language. Basically, what person first language does is put the person first. So the right side is the example of person first language, in which instead of saying a disabled person, you're saying someone with a disability. Or instead of an autistic person, she has autism. Instead of he is mentally ill, he has a mental health condition, so that condition or disability is not defining the whole person. Although, again, those in the autism and deaf communities, because their communities can be really strong and they may prefer to use identity first language, but if you're not actually in the community, it's more respectful, again, to start with person first language and then to switch based on their preference. It is important also, the language is always changing, so it's important to note that while this may be the more appropriate at this time, it's always changing, and it's important to keep up with, just to be inclusive of those people again, and use that language that is respectful towards them. Some other terms to avoid include saying suffering from or victim of, because if someone has a disability, that's likely not going to change and it's part of who they are. So it's important to respect that and not see that as a downfall, rather just part of who they are. And then so you can kind of have a look at the rest of these that are person first language and how they can be applied. So this just outlines some kind of do's and don'ts about how to communicate if you're not sure how to communicate to someone who has a disability. It's important. The main thing is just don't be intimidated by their disability. You speak to them as you would to anybody else. If somebody has an interpreter or an aide with them, you should still speak directly to that person rather than their interpreter or aide, because that person is speaking for them. But you should still maintain eye contact and speak to the person that you're meaning to speak to. And use clear and simple communication that's easy to understand and won't be confused. If you don't understand what somebody's saying to you, do not pretend that you do, because that will lead, especially if it's about their support needs and you pretend that you understand and you don't, and then you do the opposite of what they're asking you to, then you're not providing the supports that they need, and you're isolating them based on their disability just because you couldn't understand them. So rather than pretending to understand, you may need to adjust how you're asking a question to make it more clear and easier for them to answer, or provide other ways for them to answer that question, such as through physically pointing or providing some sort of visual board that will help them communicate. Do not talk down with someone with a disability. You shouldn't assume that someone has an intellectual disability. You should never speak to someone as a child just because they have a disability. And again, do not raise your voice when speaking to someone with a disability unless they have hearing loss and specifically ask you to do so. Although those with hearing impairments likely have some sort of technology or strategies that help them to hear, and it doesn't really help for you to raise your voice. When interacting, if you think somebody needs assistance, make sure that you still ask and don't just assume that they do need assistance, but of course provide it if you ask and they agree that they need assistance. If someone has a visual impairment and they accept your help, when guiding them, you allow them to take your arm rather than you taking their arm. And in doing that, you're making sure that you're not really pulling them through the environment, but they're able to control their pace with just your arm as a guide of where to go. And there are more resources if this is applicable to you for the specific practices and how to guide somebody with a vision impairment. If somebody uses a wheelchair, You should place yourself at eye level, but not necessarily by crouching down. What you can do is just take a few steps back so that you're able to maintain eye contact without you looking down or them looking straight up. And with that, if you are going to be talking for a while, then just as with a normal conversation, it may be helpful just to find some sort of table where you can sit down to have your conversation and maintain your eye level throughout it. It is important if somebody has an assistive device, such as a walker, a wheelchair, you should never touch, move, or lean on their assistive device without their permission. Their assistive device is an extension of themselves and is considered part of their personal space. Again, do not automatically assume someone needs help, and do not crouch down to someone who uses a wheelchair. So this is not, of course, it's always changing, and this is not totally inclusive of everything you should do, but it's a good kind of general knowledge. It is very important to remember that you're going to make mistakes, and it's okay. The main things to keep in mind is to be respectful and just to be always learning and listening to those that you're interacting with on what their preferences and support needs are, and just really being a good support and advocate for them. So in the next couple of videos, we're going to talk a bit more about specific conditions you may see and how what specific support needs may be applicable to those.